For gynecomastia, the first step is to examine the patient and see. Clinical examination is it's very relevant and very important and gives a diagnosis. But in some cases, when we take the history, there is a history of hormonal imbalance or hormone use, or some people use some steroids. In that history, we need to check the blood. We need to do the blood investigation, in which we can check the hormones. Estrogen, testosterone, HCG, and some other hormones that we can check it for those patients. And in some cases, we also have secondary gynecomastia, secondary to some tumors in the body, and they are very rare conditions that we need to do some scan. In some patients, it is secondary to testicular issues, so we need to examine the testicular area and do the relevant test according to that. Majority of the time, in more than 75% of the time, the patient clinical examination is only what is required. There is also you can do an ultrasound of the chest area, which will show the glandular enlargement and some fatty glandular enlargement. As the gynecomastia is of a different type, and some gynecomastias predominantly gland is enlarged, which is the breast gland. In men, usually the breast gland is a rudimentary organ, so it doesn't have a big size. So if it enlarges, it is abnormal. So that can be shown just on a clinical examination, and also the ultrasound examination of that area can also show that there is an enlarged breast and fat gland.